Namibia is one of the few countries where they launched KAMA in 2009 when it was agreed that we should launch KAMA. Not only did they launch, they went ahead on their own to make sure that not waiting to be nominated. The First Lady, Mrs. Pohamba, went ahead to launch KAMA, brought many other colleagues and even First Ladies to come to Namibia for the launching. And even beyond that one, anytime she has interventions, I think she'll be invited, the First Lady of I think Zambia, if I remember recently, and took her to different hospitals for them to look at it. So these are good examples of how the First Lady and the President is really supporting issue of maternal health. And at the African Union Summit, at the 20th session of the African Union Summit in January 2013, President Pohamba was among the, I think, 5 head of states or presidents who spoke in really supporting maternal health. There were 51 countries there. President Pohamba is among the very few presidents who had time to be able to speak, and he spoke about the commitment of the government and how they're going to work to support it. And the Minister of Health brought Ministers of Health to Namibia in 2012, I think 2012 or 2011. They brought them together. They also discussed the issue of KAMA in Namibia. So for me, the commitment of government is coming up. They're doing it very well, and the results are coming. You know that in the past, Namibia used to have about 200 women dying per 100,000 live births. The figure got worse and went ahead to get about 300, which means things were getting worse. And the reason was because of the use of HIV/AIDS around that time. Many of our women were getting infected, and some of them were dying related to HIV/AIDS in pregnancy, but not necessarily because of the pregnancy, but because of immunocompression. But the government has risen to the task now, and the figure has now gone back down to 200. It means, if you look at it in the context, it's as if Namibia has not changed, but Namibia, if you look at the trend, Namibia has changed. They were 200, it went worse, now it's gone to that level. So if we continue those actions of the government interventions, responding in where the population is busy in around the Shakati area, where about 80% of the population of the country is residing, we will do more, and then we will work. If you ask me what is the government doing, I think number one, they are equipping the health facilities to make sure that they are well good to be able to work. They are also taking this issue of maternal health down to the communities, to the districts, where they are working through the district now to say that small health facilities are well equipped. They have midwives, they have ski bath attendants in those places. And I think the government is beginning to do some community interventions now, where the people in the rural areas can be encouraged to come to the clinic, so that traditional people who are not able to deliver the women are not the ones keeping them for too long. So some of these actions are working. And I think the other thing that the government is doing is to bring all partners that if you are working on maternal health and you want to support us as a country, put all your ideas and your knowledge together, let us sit around the table. The government says, I don't want you to be working in a place I don't know. Let us sit around. There are this number of districts in our country. These are the things we want to do. You work here, you work here, you work here. Let us sit around again at this table in about 2 or 3 months' time. How are we progressing? So some of those things that they are doing in the country, I think we have to acknowledge. And it's beginning to yield some good results. So I think in terms of that one, Africa-wide, we have reduced, Africa-wide, we have reduced maternal mortality by about 41%. In terms of on average, that includes Namibia, calculated around that. But if you look at it in terms of the rate at which we have progressed, I think we have to tell ourselves that if we had started early, we would have been much better. Because Africa developed a continental policy in 2005, when we are supposed to have started in 1990. We got to 2005, developed it. In 2006, we developed Maputo Plan of Action. We launched KAMA in 2009. The speed at which we are running to move things now, if we started 1990, we would have even surpassed 75% that they want us to get by 2015. So my advice and suggestion to all African nations, including Namibia, is this tempo, this commitment that we have from the First Lady, from the President, where they want to give money, let us continue it. Let us not wait.
I equally speak today for the young girls aged 15 to 19 who are at risk of teenage pregnancy. which has the potential of resulting in maternal injury or death. I can therefore say that I speak for mothers, young and old, who are injured and die needlessly in pregnancy and childbirth from one of the preventable causes.